Mayur, Mayur, is that Mayur? Hello, hello.
Hi, sir. Good evening.
Hi, good evening. Mayur, I'm around. Just stepping out for a minute. In case the doctor comes, just make him the co-host.
Sure, sure, I'll do.
Yeah, okay, thanks. Hello, doctor.
Hello,
Hello, good evening.
good evening. The has it started?
No, we have not started yet.
All right.
So we'll start in the next 7 minutes.
No issues. I'm here. Let me know whenever we want to start. I'll start it. All right.
We'll just check the video so that, and then you can go off.
Yeah. Just give me a second. Hello.
Hello. Yes.
Is my video clear?
Yeah. Can you put your mobile phone like this? Yeah.
Okay. Good.
And no, this is fine. This was fine. That
Till it
one.
starts, I'll hold it like that. Once it starts, then I'll tilt it again.
Yeah. So when you do that, when you move, just sit in the center.
Sure.
Yeah.
All right.
Mayur,
Yes, sir.
when you play a video now, don't hover your
Cursor.
cursor on the video,
Okay.
because it then shows.
Sure, sure, sure. I won't do this.
Are you using the same machine as Firoz would use?
Yeah, sir.
That's not a good quality machine.
Yeah. Ask them to change it, sir.
Have you asked them already?
No, no, sir. I haven't yet, but I will now because now it's creating more problems.
Yeah. Because the video also doesn't come out very clearly.
Hmm. Yeah.
Yeah, doctor, we're going to start now in the next 2 minutes. Doctor, we are starting now.
Sir, I'm playing the video.
Yeah. Hello and welcome to Health Live at Seniors Today. We are delighted to welcome you all on this August 1st, 2026 for a special session which we feel is something that we've got from feedback with some of you, which is necessary, and that is psychiatric care and emotional well-being for seniors living with illnesses. And for this, we've invited a senior geriatric psychiatrist who's head of the Department of Psychiatry at the Ruby Hall Clinic in Pune and founder and director of Insight, the medical clinic. Before I invite him, I'm going to introduce him. So, Dr. Hamza Hussain is a gold medalist and one of India's foremost psychiatrists, specializing in integrated holistic methods with traditional psychiatric. His pioneering approach addresses mental health conditions such as depression, anxiety, bipolar disorder, and OCD. With a deep understanding of both Western medicine and alternative therapies, Dr. Hussain has developed side-effect-free treatments that combine psychotherapy, counseling, yoga, psychobiotics, and low-dose antidepressants, helping patients achieve long-term mental wellness. We welcome Dr. Hamza Hussain here. Dr. Hussain, are you there? Dr. Hussain was here just now. Dr. Hussain, can you unmute yourself? Technology is sometimes a problem. Yeah, doctor, are you online? Doctor, you're online. No, I can't. I can hear you now on the phone, but sorry, we see doctor here, but his internet is a bit of a problem. So he will join us in the next few minutes. Please bear with us. Doctor, I suggest you log out and log in again. These things happen with technology. I'm sorry about this, but we will have Dr. Hamza Hussain joining us any minute to talk about psychiatric care and emotional well-being for seniors living with illnesses. Okay, he is logging in again. In the meantime, can I just grab this opportunity to, in case anyone from here wants to give any feedback, any request um, for treatment areas that we should be discussing? Is there anyone here who would like to speak? Please put your hand up, raise your hands, and yeah, who's this? Mr. Jamunathan, yes, please, please unmute yourself.
Yeah, you have muted all of us.
Yes, we have muted all of you because
Yeah. So that is why probably even Mr. Doctor is also muted that way.
No.
Has he been made a co-host?
Yes, he has been made co-host.
Oh, then it's problem. Even then, certain times our Zoom meets that you have
No
to
worries.
again.
Doctor has joined again, and hopefully he will be absolutely all right.
Yeah.
His connection will be absolutely all right. Yeah, doctor. Yes, great. All right. Thank you, Mr. Jamunathan. Thank you very much.
I am so sorry for keeping you all waited.
No, not
There
at all.
was some connection glitch.
Yeah, these things
So-
happen, doctor. But now you've connected through your laptop, which is even better. So we introduced you before this, and we played a video as well where you may have had some of your friends and colleagues as well over there. So the topic, doctor, as we discussed, is since you are a medical psychiatrist, if I might add, and is on psychiatric care and emotional well-being for seniors living with illnesses. And what we'll do is, for a topic like this, we don't think a presentation is what is important. We'll request Dr. Hamza Hussain to speak for 10 minutes, and then we will take questions. I see that some questions have already come in. So, doctor, what we do is we request the guest doctor to speak or make a presentation, in your case, speaking, and then the questions will start coming in, and I will take the questions to ensure that there's no duplication whatsoever. Right. So that's it. Over to you, Dr. Hamza Hussain. Remember that sessions like these are advisory in nature, and in case you do have a specific concern, then you must speak to a doctor in your city or town. And of course, you can also get in touch with Dr. Hamza Hussain directly as well. And this session is being recorded, so it will be up on our website on Monday, August 3rd evening. So do check it out. Over to you, doctor.
So good evening, everyone. And thank you very much, Seniors today, for having me here today. As sir mentioned, I'm Dr. Hamza. I'm a psychiatrist. Now, one peculiar thing which I've noticed whenever I speak to people and I introduce myself as a psychiatrist is some of them usually smile at me and others think that, hey, doctor, I'm not mad. But here's something very interesting. Most of my patients are not mad. Psychiatry is more about helping people sleep better, worry less, find hope again, enjoy relationships, cope with illnesses, and most importantly, to live and not just exist. So before we start this talk, I would just like to start with a story. So a gentleman, let's call him Mr. Sharma for this instance. He was a 73 years old. He had diabetes, hypertension, cardiovascular disease, just had a major bypass surgery done a couple of years ago. He was taking almost 10 medicines on a daily basis. His cardiologist was very happy. His physician was very happy because all health blood reports were excellent. There were no issues in any of his blood reports. Diabetes, hypertension were well controlled. His heart was functioning very well with the graft. So I asked him, how are you doing? And he mentioned to me that I am alive. And that sentence stuck with me. So these days, what we have observed is that science has evolved a lot. We have been able to transplant organs. We have been able to reconstruct the knees. We have been able to do a lot of things. But we sometimes forget that we are and not everything is a disease. There are two major things which I usually believe in. One is a disease and one is suffering. So disease is something which it is in a body or an organ or something, and suffering is what we have in our mind. So it is always important if we also look for the suffering and not just curing diseases. Many times, like I have heard people saying that while we age, it is normal to feel low or it is normal to have some forgetfulness. But is it so? Is growing older with all these things normal? Growing older is obviously normal, but living without joy is what? Do you think it is normal? Because people say that everyone worries at his age, but excessive worry or anxiety or living with a constant tension, is that normal? Everyone says that memory becomes weak at this stage, but sometimes it does not always means that the person is having some condition. It might also be because he is sad, he is depressed, he is feeling lonely, right? So it is always good if you also answer or listen to one of the most important organ in our body and not just to the physical body symptoms. It is okay to feel normal. It is okay to feel lonely, but you should also take care of yourself. You should make sure that you are also feeling happy. Nowadays, because of technology, we all have, we are, the connectivity amongst us has increased, but the actual emotional connectivity has decreased a lot, right? So, and this specifically hits older age people because of again technology and advances, the children are living somewhere else. The parents are usually staying alone. Sometimes there's only a single parent because the spouse is not living anymore and stuff like that, and the person starts feeling lonely. So it is very common these days to have all these symptoms, right? So I want all of you to open up, to bring up your doubts, question me whatever you want to, and let us talk more about mental health today.
Thank you. Thank you very much. Uh, so, Doctor, we have a few questions that have come in already.
Yeah.
This is from, and what I'm going to do is I'm not going to give out names of people who have asked questions just to protect their identities. So there's one question that has come in which says, my mother is suffering from hallucinations and she needs help.
Okay. All right. So, see, basically, hallucinations can be because of many reasons in old age. Sometimes it is because of old age psychosis, right? Sometimes it can be dementia, which is causing hallucinations, uh, dementia with psychosis and something like that. So, that hallucinations comes under a broader term called psychosis, and that needs treatment, that needs medical attention, that needs some antipsychotics, which can very well control hallucinations. So, it is not normal to have hallucinations, but it is very much treatable.
Right. Another question that has come in is which says that her husband has bipolar and
Okay.
will meditation help her husband, and how helpful will it be?
All right. So see, basically bipolar, for everyone who don't know what is bipolar, so there are two poles. If, for example, if this flat line is my mood, then there is a curve above and a curve below. So the curve below is your depression. Basically, the smaller curves are your normal mood swings. Larger curve down is depression, and larger curve up is mania. So the upper one is one pole, and the lower one is another pole, and this is called bipolar, in which you have alternative episodes of depression and mania, right? So, first of all, it depends on what, there are a lot of kinds of bipolar, like bipolar with, in normal terms, bipolar in which depression is more often coming, bipolar in which mania is more often coming, bipolar in which both are fluctuating now, cyclically and stuff like that. So overall, mindfulness and meditation does work for any of the illness, or let's say even for normal life. Meditation is always helpful. Okay, it is not necessary that only people with bipolar will benefit from meditation, but it doesn't specifically treat or help in controlling bipolar disorder, especially if it is of mania type. If it is if the current episode of bipolar is depression, then maybe it can be helpful. But if it is more of the on the manic side, then meditation, the patient most probably won't be able to do meditation. But yeah, meditation is generally helpful.
Right. There's a question that has come in: is psychosis genetic?
See, almost all psychiatric disorders are multifactorial disorders. So just like our diabetes and hypertension, we don't have a single causative factor for diabetes, hypertension, and such kind of disorders and lifestyle disorders. So these disorders are called multifactorial disorders. Matlab, there is no single causative factor to it. There is no, let's say for example, dengue. So we know if a female Anopheles mosquito bites us, and if that virus is passed, then only a person will have dengue. But that is not the case, let's say, with diabetes, hypertension, and with any of the psychiatric illness. So no psychiatric illness has just one causative factor. They are all multifactorial. And the factors usually start from genetics. So genetic plays a lot of role in psychiatric disorders. It can be like it can be involved as much as 10% to 70-80% can be contributed by genetics. But it varies on case to case basis on how much genetic load a person carries.
Right. We have a question which is interesting because, and that's another question that I've got here, which is from which is saying for anxiety, ADHD, can that be treated by a psychologist or a psychiatrist? And the other question that I've got is that who should one visit for psychiatric help? Should one meet a medical psychiatrist like yourself, or should one meet a psychologist who's a certified psychologist from a well-known institute, but she or he is not medically trained?
Right. So this is one of the most common doubts and sometimes even a myth. So psychologists and psychiatrists are two different persons. A psychiatrist is a doctor. Basically, they have done their MBBS and then they have pursued psychiatry as a subject, just like they pursue internal medicine and then cardiology and stuff like that. So it's an MD or DNB in psychiatry. And a psychologist is someone who has done their Bachelor of Arts in Psychology and then doing the Masters of Arts in Psychology and then maybe MPhil. And then they are eligible for getting the title as clinical psychologist. If they don't do the MPhil, then they are just psychologists. So psychologists are basically the one who are supposed to do therapies, and a clinical psychologist can also do assessments. So there are a lot of tests like in normal medicine we get lab tests, we get blood tests, we have radiological tests. So in psychiatry we have assessments. So these are the objective tests. It is mostly of talk kind of thing or questionnaires or projective tests. So these kind of assessments are to be done by clinical psychologists, which helps in diagnosing a condition. So they can come to a diagnosis, objective diagnosis, whether a patient is having anxiety, depression, ADHD, autism, stuff like that, and to grade the severity of that particular illness. For example, how severe is the depression, how severe is the anxiety, how severe is the autism, and so on and so forth. The second thing which psychologist does is therapies. So there are immense number of therapies, starting from behavioral therapy, then there is art therapy, there is REBT, rational emotive behavioral therapy, there is mindfulness, CBT, stuff like that. So psychologists are usually trained for giving therapies, and if the psychologist is a clinical psychologist or RCI licensed one, then they are also trained to do assessments. Whereas psychiatrists are trained for therapies, obviously, and also for giving medications. So they prescribe medication on top of therapies. So usually what I prefer is that a patient should first go to a psychiatrist, and then a psychiatrist can evaluate them. Then he or she can tell them that, you need medications or you will be fine with therapies and what kind of therapies you would need. And then he or she can go to a psychologist. Or a psychiatrist, if a psychiatrist feels that the patient needs assessment, then they can guide the patient to the right psychologist who can do the assessment and give an objective report of that. So as far as my knowledge is concerned, a patient should first come to a psychiatrist, and then if he or she feels right, then they can go to a psychologist as well. But therapy is an important form of treatment. Uh, there is a lot of benefits which we get by therapy. So there's a lot of things which we can do in therapy as well. I'm sorry if I haven't completely answered your question. It was a complicated one, but I have tried to answer it. Still, if you have any doubts, ask me, and I'll again,
So another question that has come in is that these days we hear about specialized psychologists who are there for specific uh, uh, groups, like students, could be for uh, pregnancy and so on and so forth. Is that something that is a done thing, or is it just by chance that we find people like these?
See, basically what happens is this is not a degree or a course or something. There might be some 3 months, 4 months, 6 months crash courses in that, but these are not proper diploma courses or degree courses which certifies you as that. What usually makes them tell that is their experience. So maybe they might have experienced a lot of child cases, or to call them as a child psychologist, or they might have experienced a lot of pregnant post. They might have counseled a lot of pre-pregnancies, or peripartum cases or post-pregnancy cases and stuff, which leads them to call that. Or they might have done some crash course in that, say for 3 or 6 months, some certificate course, which also gives them that authority to put them as a specialty. But as such, there is no specialty wise existence of psychologists right now, as far as my knowledge goes. I might be wrong, but as far as I think, there are only two main branches of psychology. One is BA, MA, clinical and counseling psychology, and one is BSc and MSc, clinical and counseling psychology. And then both of them are eligible for MPhil, which certifies them as an RCI licensed clinical psychologist. So as far as I know, but I don't know if they can actually put that they are specialized in. Maybe most probably it is based on experience why they might be putting it.
Right. We have a question that has come in. Can medicines given for bipolar disorder lead to dementia if taken for a long period of time?
Not really. So dementia is in itself a condition. So let us not talk about dementia. It can be forgetfulness. If we are framing the question properly, can bipolar disorder medicines cause forgetfulness is the right uh, framing of the question. Because dementia itself is a disorder. So one disorder leading to a second disorder is unlikely. However, even forgetfulness, there are very, very few medication whose side effect is forgetfulness, but that is also a very rare side effect of that medication. So we need to check on what exact medication are they taking for bipolar, because there are like 30, 40, 50 medications which exist, which can be given to a patient with bipolar. So not every medication has the same side effect. So it is possible, but it is not very much likely, but it is not completely impossible as well.
Right. Doctor, there's a question which has come in. There are some anti-anxiety pills which are available over the counter at chemist shops. Are these advisable?
I think I will need names for that because no anti-anxiety pills are actually available at the chemist. These are prescribed medications. The chemists are not supposed to give any anti-anxiety pills without prescriptions. So I'm not sure which medication are they getting.
Okay, the person might just send a.
If it's in the name, then we can talk about it.
If too much sweat comes when one is stressed, to whom should one go and see?
So it depends on why exactly is the sweat coming. Is it because some people have a tendency to sweat more? Is it because of that? Is it because the person is feeling more anxious or is worried about something, or is having any other issues going on? If it is because of that, then see a symptom like that can occur in any kind of disorder, right? So we can come to 100 number of differential diagnoses here, but uh, I would first suggest him or her to go to a general pediatrician where he can get his check done. It can also be sometimes because of some deficiencies. So maybe a GP would be the best person to approach first. He might be able to guide the patient further on what exact specialty, what exact problem he or she is having, and then they can go to a specialist maybe.
Right. Doctor, the person has sent a message saying tablet Ativan, ATIVAN, 1
Okay.
mg.
Right. So Ativan is basically lorazepam. It's a benzodiazepine. No chemist is supposed to give you Ativan OTC or over the counter. If he is or she is giving, the license should be seized immediately. Apart from that, Ativan is a addictive medication, or let us not use the term addictive right now for medication. Let us say dependence causing. So you can depend on that medication. You can cause yourself to become dependent on that medication. Benzodiazepines are usually being given only to manage anxiety, but on a SOS basis. So if the patient is having panic attacks or something like that, then maybe I'll prescribe benzodiazepine. Benzodiazepines are usually not preferable to be given long term, and they are not supposed to be given OTC. So that is bad at the pharmacist part.
Doctor, there's a question from.
Just a second. I just want to finish that question up. So these drugs, benzodiazepines, can cause forgetfulness in future. So someone had asked about dementia, right? So
Right.
benzodiazepines in particular, clonazepam, lorazepam, and stuff can cause more specific to that. They can cause cognitive issues later on in the life. So if you are taking them for a longer period of time, then they can cause cognitive issues, and that is the reason why pharmacists are advised not to give them OTC. They are scheduled H drugs. They are supposed to be given only on prescription basis, because a doctor knows for how long can the drug be given, or in what situation is it necessary. I'm so sorry.
We have a question that has come in. Uh, this is in Hindi. I'm going to just say it. I'm not very sure whether Hassan is a senior citizen, but nevertheless, I will ask. डॉक्टर, मेरे बेटे को बचपन में 2 बार दौरे पड़े हैं. बाद में 5 साल दवा चली. उसके उसको भूलने की परेशानी है, क्या करें?
I should answer this in Hindi.
Yeah, you could. Yes.
ठीक है, तो देखिए अभी उनको दौरे क्यों पड़े हैं, पहले तो वो देखना पड़ेगा. उनकी उम्र जो आप बता रहे हो उसके हिसाब से, मतलब यूजुअली 7 साल के बच्चों तक उनको बुखार की वजह से दौरे पड़ सकते हैं, जो बहुत नॉर्मल चीज़ है, और जिनको फेब्राइल सीजर्स कहते हैं. तो पहले तो हमें ये देखना पड़ेगा कि दौरे पड़े क्यों है उनको. सेकेंड थिंग, उनका डेवलपमेंट कैसा हुआ है, उनके अभी माइलस्टोन्स क्या क्या अचीव हुए हैं, अभी उनकी एज क्या है, और ये भूलने की बीमारी क्यों हो रही है. भूलने की बीमारी बहुत रीजंस कैसे हो सकती है. एक तो अगर उनके ब्रेन को कुछ डैमेज हुआ तो उसकी वजह से हो सकता है, या फिर अगर वो एंग्जाइटी डिप्रेशन में है तो उसकी वजह से हो सकता है, या तो वो कोई बात को लेकर चिंतित है तो उसकी वजह से हो सकता है. तो बहुत सारे रीजंस है कि उनको भूलने की बीमारी क्यों हो रही है अभी, और उनकी एज क्या है वो ऐड करेगी. उनका क्यों उनको दौरे आए थे वो आपके डॉक्टर ने केस शीट में लिखा ही होगा कि उनको दौरे क्यों आ रहे हैं. उनका उसका कुछ नाम होगा वो दौरे का. तो उसके वजह से हमें पता चलेगा कि भाई क्यों ये हो रहा है.
Right. Thank you. We have a question from someone. I am male, 78. My classmate of my age group, who lives in the US with his son and daughter, has developed recently early signs of dementia.
Okay.
And even though he is mobile and moves about without any need of assistance, he's getting a little withdrawn and less communicative. He used to be very lively and talkative during the college days and also as recently as 3 years back. In the US, he's getting adequate medical care and his family is very supportive. Knowing a little bit about dementia, I decided on having a video call once every Saturday for about 30 minutes. Other than engaging and talking to him, what else can I do? Appreciate your guidance.
That's actually a very good and relevant question over here. So, dementia unfortunately is on rise. We don't know why. It would have helpful if you could have also included the name of dementia which he is having. Nevertheless, almost all dementias have the same symptomatology. The prognosis differs from one illness to another illness. Obviously, there are also some symptom changes in different kind of dementia. Looking at your whatever small history you have mentioned, I am guessing it's Alzheimer's right now, but maybe we could have been benefited more if you could have named the dementia. To answer how you can help him, already the family is doing one good job, which is doing video call with him and trying to engage him. So basically, what I suggest is he should be moved a little bit more. Like he should be doing his movements regularly. One thing. Second thing, if someone can, he should be more involved rather than just once a week, if it is possible. You can enroll him in some kind of support groups. There are a lot of dementia support groups in which he can enroll, and he can be taken care of. He should be involved in a lot of activities, especially the activities which involves him to think, so that his brain keeps, like, we can stimulate his brain in some ways. So these are the few things which you can do to actually benefit him more. So basically, keeping him more involved in things. Don't start neglecting him because he's having dementia, or don't start thinking that इनको तो वैसे भी कुछ याद नहीं रहने वाला, which creates more of loneliness on top of dementia, which again increases the dementia. So keeping him more and more involved in conversations, at least trying to take his advices, not showing him that he is having some condition, acting normally around him, involving more and more in day-to-day activities, getting him to different support groups, making him go to different places, roam about a little bit in the society and stuff. Of this, this should be under guidance. He should not be left alone anywhere. So yeah, these are certain things which can actually help him.
Doctor, this is a question that has come in. I'm 75. I have my children who are, Doctor, are you there?
I'm there.
Okay. I'm 75. I have my children who are in their 40s and they are in the prime of their career. I have recently been diagnosed with cancer. And one of the problems that is there and why I'm very depressed these days is because my children are in the prime of their career and I do not want my illness to impact them. I also feel that there's a fair amount of expense that is there for my medicines and for my well-being. And I don't know how to get out of my depression. Please help.
Right. So first thing which I want to advise all the elderly people who are watching this is that we all think that we are becoming burden on our children, and sometimes people preferred not to be burdened, so they prefer to die instead of being burden on someone. So but what you need to think what exactly your children are thinking. So we just assume that we are becoming a burden on them, and then we start thinking a lot, or maybe making our assumptions in which they might be feeling this, they might be feeling I'm a burden, but they might actually not be feeling that unless and until they have told you explicitly about it. So if you are getting such doubts, you can maybe talk to them about it, right? Which can reduce your pain or your suffering again, or your assumptions. Second thing is that if you want to decrease burden on your children, then try to make yourself healthy. So you follow your routines, you take your medications on time, right? You go out for walk, you do stuff which can help you to be normal, or get rid of your illness, or at least tackle your illness on how much as you can, because you said that you are having cancer. I'm not really sure on what stage you are, and I'm very sorry for that. But whatever you can to make yourself more healthier or stuff like that, then that might help your children more rather than just thinking that I'm a burden. And if you feel so, then maybe talking to them might also help. Right?
Right. Thank you, Doctor. We have one last question, and which is a very general question. And I can take the name because it's a very general question. This is from Mr. Jammunathan again. He says, how does one maintain good mental health, and what are the helping factors?
Well, so before I started, I wanted to give you 5 prescriptions, right? I will give you 5 medications which you should take daily in order to maintain a very good mental health. So the first prescription is that movement. So you should move yourself. You should either, I'm not saying about walking. You can do gym. You can jog. You can just walk. You can do whatever you want, but some kind of movements. So movements helps a lot for maintaining your mental health. Second, challenge your brain. Don't stop challenging your brain. Don't think that I am too old to challenge my brain now. I am too old to learn something. I have heard a lot of adults, elderly people who say, "Okay, why should I learn technology? What would I do by learning technology? Or how it help me?" But it is not always for you to get help that you are learning technology. It is to keep your mind engaged in something. It is to learn something new. Because as much as you stimulate your brain, you keep it is like kind of exercising your brain. So I'm sorry. So
Sorry, go
you
ahead. Sorry.
yeah, so you can learn technology, you can learn some language, you can learn whatever keeps you happy, right? But learn something. Challenge your brain, take help of your brain, do something which is actually uh, stimulating your brain. This is the second thing which you can do. Third thing is do what makes you live your life as you want it. So basically, you can do anything which makes you feel heard, which makes you feel happy. Like, for example, gardening or whatever it is, just talking with your grandchildren or going out in a park, talking with your friends, and something like that. Don't just, bury yourself into one room or something like that just because you're not able to walk much and stuff like that. Fourth, sleep properly. Sleep is one of the most important thing, and I have a lot of elderly people say me that because I'm old, obviously I won't be able to sleep more. I understand that sleep decreases as we grow old, but that doesn't mean that we do not sleep at all. So make sure you sleep adequately, right? And finally, if you feel that there is anything which is bothering you, never hesitate to ask for help. See, if your knee is hurting, you'll go to an orthopedician, right? If your chest is spinning, you will go to a cardiologist. So if your mind is hurting, if you are feeling lonely, if you are feeling depressed, you're feeling anxious, you are not able to cope up. If there is anything which is there, don't hesitate to ask for help, right? So you can ask for help, and asking for help is not a shame, it's more of wisdom. So yeah, you can remember these 4 or 5 things, which doesn't come in strips, but it can add a lot to your life.
Thank you very much. These are amazing words of wisdom. Uh, Thank you very much, Dr. Hamza Hussain, for being here and for addressing a very sensitive topic which concerns senior citizens. And as somebody mentioned, it's not just about the mind, it's not just about the illness, but it could well be about financial health and how that impacts everyone. Once again, thank you to Dr. Hussain, as well as to the team at Ruby Hall to facilitate this. And to all of you here, thank you very much for joining in. We will be back once again next Saturday at 5 p.m. We have a session on which is being conducted by a liver specialist, a very senior liver specialist. And do join in. And thank you to Dr. Hussain once again. Thank you very much.
Thank you very much. And sorry for the technical glitch in the beginning.
No, these things happen. We are all in an age where Zoom is there. Folks, do remember that next Saturday is when we have a session on liver. Next Sunday is our finale of season 21 of Seniors Have Talent. So do join in that. I must make an advance alert that we do not have a health webinar on August 15th. It's a Saturday, and I know a lot of you would perhaps be out, and we don't want to discuss a issue around health on that day. But we have a special program, which is a musical program, which is celebrating India, and do join in on that. It will be at the same time, 5 p.m. on that day, and we will put up the notice once again. So no edition of the Health Live on August 15th. It's August 8th and August 22nd. And once again, thank you all. Join in at the Evergreen Club. We have sessions every day. The magazine you are aware of, the next issue will be out on August 15th. And of course, our daily newsletters. Do subscribe. Thank you again to Dr. Hamza Hussain for taking some valuable time.